Hello students, in the last session we have completed kidney transplantation or renal transplantation. In this particular session we will be learning types of kidney failure. Okay. Firstly, what is kidney failure? Kidney means renal. Okay, kidney failure is also known as renal failure. So when the kidney will fail to function properly, whenever there is high BP problem, or else if there is any injury to the area where the kidneys are located, right, or else if there is many chronic infections to the individual for several years. Okay. So there are n number of reasons for kidney failure, and when the kidney fails to perform its functions, what will be increasing in the blood? There will be increase in the toxic substances such as drugs, pigments and many antibiotics जो दिए जाते हैं doctors prescribe for curing any infections. Major part is not of use. So that toxic substances will also enter in the blood and it will rise. The amount of toxic substances will rise. Okay, similar way it will also affect the excretion of the nitrogenous waste such as urea, uric acid, creatinine, hippuric acid. So all these nitrogenous wastes which are not of use for the body has to be thrown on regular basis out of the body. Okay, but this process will be inhibited if there is damage to the kidneys. Okay. So what will happen in the blood? There will be increase in the concentration of the nitrogenous waste, as well as there will be increase in the many other toxic substances such as drugs, and many pigments will also increase in the body, and these drugs and pigments are not of use wholly for our body. Okay. So it will affect the other systems also indirectly. और osmoregulation का भी important function है kidney का. So osmoregulation will also be affected, means there will be imbalance in water and salt concentration. Okay, got it. So electrolyte derangement will be there, change in the pH, then increase in the potassium ion concentration, as well as there will be decrease in calcium ions concentration also. Okay. जितना कैल्शियम रीअब्जॉर्ब होना चाहिए उतना रीअब्जॉर्ब नहीं होगा, एंड इट विल अफेक्ट द कैल्शियम लेवल, नॉर्मल कैल्शियम लेवल विच हैज़ टू बी देयर इन द ब्लड. ओके, गॉट इट. And it may, in severe cases, because of excess malfunctioning of the kidney, it may result into hematuria, proteinuria, ketonuria. These disorders we have already discussed. Okay. Now we will study exactly what is the definition of kidney failure. Okay. Kidney failure was formerly known as renal insufficiency. पहले उसको क्या बोला था? रीनल इनसफिशिएंसी. मीन्स किडनी बराबर से फंक्शन नहीं कर रहा है, जितना फंक्शन करना चाहिए उतना नहीं कर रहा है. Got it? That's why formerly it was known as renal insufficiency. Okay. Then kidney failure is defined as medical condition. Kidney failure is what? Medical condition in which kidney fails to adequately filter toxic substances and waste products from the blood. Okay, as I told you, what will increase in the blood? Toxic substances and nitrogenous waste. Then as there will be derangement of the electrolyte, potassium ion concentration will increase, imbalance in the ions, sodium ions, potassium ions, calcium ions, उनका concentration जितना रहना चाहिए उतना नहीं रहेगा, कम ज़्यादा हो जाएगा. That means it is affecting the whole systems indirectly. Okay. Kidney failure can be of two types: acute kidney injury and chronic kidney injury. Acute kidney injury अभी recently उसको नाम दिया है acute kidney injury. Formerly acute kidney injury was termed as acute kidney failure. Similar way chronic kidney injury रिसेंट नाम है ये डिसऑर्डर का. पहले उसको क्या बोला था? क्रॉनिक किडनी फेल्यूर. ओके. नाउ लेट्स स्टडी the difference between acute kidney injury and chronic kidney injury. Acute means sudden. जब भी sudden damage होता है किडनी को, okay, at that time its functioning will be immediately affected, okay, and sudden damage हो जाने के बाद after taking proper treatment, dialysis पे रख के, after certain sittings of dialysis, person's kidney will resume its own function and there will be proper balance of the electrolyte, osmoregulation, nitrogenous waste जो excrete कर रहा था वो बराबर से वो सब हो जाएगा. Got it? That means acute kidney injury is curable and chronic kidney injury, chronic का मतलब ये है progress, it is a progressive disease and slowly and gradually it progresses. In chronic, many years or else months are needed for major malfunctioning of the kidney. Okay, so malfunctioning of the kidney is there, but it progresses slowly, and since many years that person is having malfunctioning of the kidney. Okay, got it? So that is chronic kidney injury. So all of you understood, acute kidney injury means suddenly होता है, किडनी का फंक्शनिंग अफेक्ट होता है सडनली, एंड क्रॉनिक किडनी इंजरी में मेनी मंथ्स एंड ईयर्स आर नीडेड फॉर imbalance in the functioning of the kidney. Okay, got it? Acute kidney injury जब भी होता है तभी what exactly happens? Serum creatinine, which is the nitrogenous waste which has to be eliminated out of the body. ओके तो जितना एलिमिनेशन होना चाहिए वो उतना रेट से होता नहीं है. सो सीरम क्रिएटिनिन लेवल विल राइज इन द ब्लड, बट दैट सीरम क्रिएटिनिन लेवल विल नॉट बी दैट मच हाई विच इज सीन इन क्रॉनिक किडनी इंजरी. ओके, क्रॉनिक किडनी इंजरी में धीरे धीरे प्रोग्रेस हो रहा है डिसीज का. सो डेफिनेटली एट द लास्ट स्टेजेस when the kidney is not doing efficient filtration, at that time serum creatinine level will be much more high as compared to serum creatinine level which is seen in the blood if the person is suffering from acute kidney injury. Okay, then second difference, acute kidney injury is curable. So definitely I have told you kidney is also involved in hormonal regulation. Kidney produces one hormone erythropoietin which is responsible for erythropoiesis. Erythropoiesis means formation of RBCs, and these RBCs are formed in the bone marrow. Okay, so bone marrow को वो stimulate करता है, ज़्यादा RBCs बनाओ, ज़्यादा RBCs बनेंगे तो hemoglobin will also be formed and thus there will be normal RBC count as well as hemoglobin concentration in the blood. If the kidney gets injured, acute kidney injury में क्या होता है, सडन किडनी को डैमेज होता है, बिकॉज ऑफ विच सडन डैमेज की वजह से किडनी का ये जो हार्मोनल फंक्शन है वो जनरली अफेक्ट नहीं होगा इजीली. दैट्स व्हाई एनेमिक कंडीशन इज वेरी रेयरली सीन. ऑलमोस्ट it is not seen in acute kidney injury, and if at all it is seen, it's very minor. Okay, so in acute kidney injury person के hemoglobin concentration में ज़्यादा कुछ changes नहीं आते हैं. Got it? So rarely person will suffer from anemia. Anemia is a condition where the hemoglobin concentration is less in the body. Okay, got it? And in chronic kidney injury exactly opposite will be there. साल लग जाते, बहुत सारे मंथ्स और ईयर्स लगते हैं किडनी के माल फंक्शनिंग के लिए, मेजर माल फंक्शनिंग होता है तो. ओके, सो आफ्टर मेनी ईयर्स किडनीज फंक्शनिंग विल lower to such an extent that its hormonal regulation will be affected, okay, which will affect the secretion of erythropoietin. And if the erythropoietin is produced in less amount, RBCs will be produced in less amount, and thus concentration of hemoglobin will also decrease and person will suffer from anemia. So remember, in CKI individual will suffer from anemia. okay, because hormonal regulation of the kidney is also affected. Then third difference, large size of the kidney. अभी किडनी का फंक्शनिंग इमीडिएटली अफेक्ट हुआ है, ओके, बिकॉज ऑफ एक्सेस ब्लड लॉस. एक्सेस ब्लड लॉस हुआ है तो रीनल आर्टरी में से ब्लड सप्लाई नेफ्रॉन को कम जाएगा, नेफ्रॉन को कम जाएगा तो एफरेंट आर्टेरियोल में से ब्लड जो है वो नेफ्रॉन के आजू पेरिवर्टिबुलर कैपिलरीज में कम जाएगा, एंड लाइकवाइज kidney functioning will be affected. So to normalize the functioning of the kidney, there is enlargement of the kidney, that is kidney size increases, okay, in acute kidney injury. Sudden damage हुआ है किडनी को तो body tries to compensate that whatever damage which is there by enlarging the size of the kidney, okay, but exactly opposite will occur in chronic kidney injury. In chronic kidney injury what happens, since months or years this kidney malfunctioning is there, okay, so जैसे जैसे years pass होते हैं kidney का malfunctioning और ज़्यादा बढ़ता है, okay, because of which kidney बहुत आलसी बन जाता है, वो बराबर से फंक्शन नहीं कर रहा है, हाँ ऐसे ही चलो चलता है, इतना स्लो रेट में फ़िल्टर किया तो और ज़्यादा स्लो रेट में फ़िल्टर करेंगे, सो डेफिनेटली द साइज ऑफ द किडनी विल डिक्रीज, ओके. सो स्मॉल किडनी साइज इन क्रॉनिक किडनी इंजरी, ओके. देन फोर्थ वन, rapid progressive loss. There is rapid progressive loss of the renal function in acute kidney injury. This I have already explained you. Wherein in chronic kidney injury progressive loss is there, but it is very slow and very few symptoms are seen in the earlier months as well as years, okay, got it. So person tend to neglect everything. Then acute kidney injury में क्या होता है, oligouria. Oligo means less urea will be eliminated out, okay, and the urine which will be excreted out will be very less than 400 ml per day. So 1.2 to 1.8 liters per day is the excretion rate of urine from the excretory system. तो बहुत ही ज़्यादा कम हो गया यूरिन का वॉल्यूम, इसको क्या बोलते हैं, ओलिगो यूरिया. सो वॉल्यूम यूरिन का बहुत कम हो गया तो डेफिनेटली अमाउंट ऑफ यूरिया विच विल बी एलिमिनेटेड आउट विल बी लेस, ओके. सो एक्यूट किडनी इंजरी में ओलिगो यूरिया कंडीशन जल्दी दिखाई देता है, वेर इन क्रॉनिक किडनी इंजरी में धीरे धीरे लेटर स्टेज में 5 स्टेजेस रहते हैं किडनी के माल फंक्शनिंग के. सो एट द एंड ऑफ द 5th किडनी फेल्योर स्टेज you will see there will be maximum oligouria seen, okay. High rate of oligouria will be seen in chronic kidney injury, okay. Then next one is acute kidney injury is reversible. Reversible means sudden damage हुआ है because of excess blood loss or else high BP, hypertension के कारण, or else if there is liver cirrhosis or pancreatitis because of any infection, okay. So sudden damage हुआ है किडनी का, but body tries to recover the functions immediately, okay, and those all functions are recovered immediately. So that is acute kidney injury is reversible, wherein chronic kidney injury is irreversible. irreversible सालों से किडनी का माल फंक्शनिंग हो रहा है और अमाउंट एंड सिवियरिटी ऑफ माल फंक्शनिंग इज इंक्रीजिंग डे बाय डे, okay, and as the years passes there is excess malfunctioning, kidney size decreases, okay. kidney size ही कम हो गया तो ultimately filtration rate बहुत ज़्यादा कम हो जाएगा and it will result in irreversible chronic kidney injury, okay. Then what are the causes of acute kidney injury? First cause can be pre-renal diseases. For example, if the person is suffering from low BP का उसको तकलीफ रहता है, हर टाइम लो BP होता है, so there are chances of less supply of blood to the kidney and thus functioning of the kidney will be affected. High BP, similar way high BP can also be one of the pre-renal cause for acute kidney injury. Okay, similar way infection to the liver cirrhosis, pancreatitis or any other infection in the area where the kidneys are located, definitely it will come under which cause? Pre-renal cause, which causes acute kidney injury. Okay, got it. Then intrinsic cause क्या रह सकता है? Intrinsic cause means inside the kidney if there is any damage to any of the part of kidney. For example, if there is inflammation of the renal pelvis, if there is blockage of the renal pelvis due to accumulation of stones. ओके, सो किडनी के अंदर कुछ इन्फेक्शन हुआ है, किडनी के अंदर कुछ ब्लॉकेज हुआ है, तब जाके हम लोग बोलेंगे कि इंट्रिंसिक कॉज है, ओके, फॉर एक्यूट किडनी इंजरी. सो बिकॉज ऑफ द ब्लॉकेज of the stones in the renal pelvis, there will be no proper filtration. Okay, so it will result in acute kidney injury. So intrinsic, all of you understood, kidney के अंदर कुछ माल फंक्शनिंग हो रहा है इन्फेक्शन के कारण, और एल्स इफ देर इज फॉर्मेशन ऑफ किडनी स्टोन्स. So intrinsic cause is one of the cause for AKI. Then post-renal cause means किडनी के नीचे जो एक्सक्रीटरी पार्ट है, what is that? Ureter, urinary bladder, urethra. So if there is malfunctioning, infection to the urinary tract other than kidney, okay, so urinary tract can be any of the part, okay, of the excretory system excluding kidney. here urinary tract में सब कुछ आएगा, kidney, ureter, urinary bladder, urethra, but here I am talking about post renal means kidney छोड़ के बाकी कोई भी urinary bladder में infection हो गया, or else if there is blockage due to accumulation of kidney stones, then definitely it is going to affect the filtration rate, osmoregulation and derangement of the electrolytes will be there in the blood. Okay, got it. So all of you understood what is pre-renal. Pre-renal means kidney के अलावा दूसरी वजह से किडनी का फंक्शनिंग अफेक्ट हो रहा है, लो बीपी, हाई बीपी, इन्फेक्शन टू द लिवर, इन्फेक्शन टू द पैंक्रियाज, ओके, देन मेनी अदर रीजंस. इंट्रिंसिक मीन्स किडनी के अंदर इन्फेक्शन हो रहा है, और एल्स इफ देर इज एक्यूमुलेशन ऑफ किडनी स्टोन्स. ओके, पोस्ट रीनल हियर इन द सेंस पोस्ट रीनल में क्या होता है, आफ्टर किडनी के अलावा कोई भी रीजन में in any of the part of the urinary tract if there is infection or blockage due to accumulation of kidney stones, it will result into acute kidney injury. Okay, then chronic kidney injury. What is the cause behind the chronic kidney injury? Because of if the person is suffering from diabetes mellitus. डायबिटीज़ मेलिटस पेशेंट्स में और भी बहुत सारे प्रॉब्लम्स होते हैं, हाइपरटेंशन, they suffer from high BP problem as well. Okay, then glomerulonephritis, inflammation of the glomerular blood capillaries as well as tubules of the nephron, because of which person may suffer from chronic kidney injury. Okay, hypertension, that is also one big factor which affects the functioning of the kidney, and these all factors will affect the kidney functioning slowly. So many years passes and after many years kidney का malfunctioning इतना बढ़ जाता है ज़्यादा कि person को हर टाइम डायलिसिस के लिए जाना पड़ता है. Okay, so treatment for chronic kidney injury, very often they have to go for dialysis and फाइनल स्टेज में जब भी किडनी जाता है, मीन्स इफ देर इज एक्सेस severe kidney malfunctioning, at that time there is only one solution, that is patient has to go for renal transplantation. Okay, got it? So ultimately किडनी का इतना malfunctioning बढ़ जाता है कि hormonal regulation पूरा का पूरा बंद हो जाता है. Okay, so for that purpose only one solution is there, that is renal transplantation. Okay, wherein treatment for acute kidney injury, dialysis for few months or few weeks depending upon how much damage is there to the kidney. So all of you understood what is acute kidney injury and what is chronic kidney injury. Very important from exam point of view. So remember everything. Serum creatinine is high in both, but it is higher in blood of patients who are suffering from chronic kidney injury. And reversible कौन सा रहता है? Acute kidney injury or else acute kidney failure. Reversible है. Irreversible chronic kidney injury. So that is all about kidney failure or else renal failure. Thank you.